Ovarian cancer is a very difficult cancer to detect early on. One of the early signs is bloating, but how many of us are bloated? And if you can't specifically tie bloating to particular food or due to a menstrual or premenstrual symptom, then further investigation with an ultrasound can be performed. It's not 100%. Again, the early detection of ovarian cancer is very difficult. But there are certain individuals who should have screening. There is a test called BRCA, which is a genetic test that looks for that particular gene mutation. And if it's present, then further testing may be undertaken. But not everyone qualifies for BRCA testing. Typically, a family history of ovarian cancer would be someone who would qualify for this particular genetic test. And the implications of it is that if it's positive, then there's a greater than 50% chance that that individual will develop breast and/or ovarian cancer in their lifetime, depending on which BRCA gene mutation was detected. Not everyone qualifies because it's a very expensive test. It's about $3,000. And if insurance covers it, there's still a pretty big copay that the patient will be responsible for, which can be 6 to 7% of the total cost. So even in those that are covered, it's still not an inexpensive test. And there's a lot of people that still, even if they qualify, don't want to know. And unfortunately, in the past, they fear the fact that if they are labeled with a positive gene mutation, then they may not qualify for certain insurances or they may not be able to get a job. But that has changed. There are parameters and rules against that. And then others just fear. They don't want to know and then now be worried because they're positive for this gene mutation. But there are implications because if an individual is positive for the BRCA1 or 2 gene mutation, then we actually do something about it. It just kind of depends on what the female's childbearing desires are at that time.